therapy, TZ1B, TZ1C, super band for a lateral hip distraction to go after the inferior and the medial hip joint capsule, give us a little more internal rotation. And then TZ1C going after the anterior hip capsule to give us more extension of the hip while we're getting more translation, forward, left rotation of those bad boys as well. So what we're going to be demonstrating with is some dumbbells or some squishy medicine balls. So TZ1B, in these positions right here, I will jam out with my common shoulder to overhead press matrix. I've got my sagittal, I've got my frontal, and then now my transverse. And now I can go my uncommon sagittal, uncommon frontal, and uncommon transverse. I can progress into a straight right lateral lunge with my right foot toed in, so in an I position. So boom, keep my trunk preset with left rotation, boom and boom. I can, just right off the bat, just keep my head, nose, and eyes going forward again. Remember some of the strategies in which we'll use to rotate back towards towards second base and or towards home plate. If I want to mobilize my thoracic spine more, I'll rotate to the left as a left-handed pitcher. If I want to mobilize my C-spine a little bit more, I'll rotate it and keep it fixated on home plate like I am right here. And I can also drop this bad boy down right above the knee to go after a little bit more of the abduction and extension, taking advantage of this longer lever arm. So I've got all my uncommon and I have my common for TZ1B. TZ1C, I'll start up, I'll go as high as I can up to the pubic tubercle there. And TZ1C, I will preset in kind of this 1C position. Just shift my weight forward and backwards. Right foot is toed in that I position. So we have our common shoulder to overhead presses. And then I have our uncommon shoulder to overhead in the sagittal, shoulder to overhead in the frontal, shoulder to overhead in the transverse. We can do the same thing by getting a little more aggressive and going right above the knee. Same thing, we'll preset and we'll go with our sagittal and our frontal kind of common presses, whatever I specify for you, and our uncommon. Well then, we'll also use the lunge position. So we're going to lunge on into these positions. So into TZ1C, I go with my common shoulder overhead in the sagittal, common overhead in the frontal, common overhead in the transverse, and then I'll go shoulder to overhead in sagittal, frontal, and then transverse. To be a little more aggressive, I would then secondarily go to the super band right above the knee, and same thing. So we can go, just demonstrate the uncommon, sagittal, frontal, uncommon, shoulder overhead, transverse. There you are. TZ1B, TZ1C with lunges, super band for hip mobility to help further unlock the transformational zones of the body, further loadings from the bottom up and then also from the top down, by enabling these rotational and translation elements from the feet to the fingertips. Ultimately, growing in our disassociation from the ground up so that the arm, shoulder, elbow complex is just along for the ride, and as a result of specifically what happens from the loadability and these sequences amongst this chain reaction like phenomenon from the bottom up.